Hello and welcome. Today we're diving into the world of the urinary system and exploring a common ailment, urinary tract infections, or UTIs. We'll cover everything from what causes them to how they're treated and prevented. So, let's get started! UTIs are primarily caused by bacteria entering the urinary tract. The most common culprit is Escherichia coli, often referred to as E. coli, which normally resides in the digestive system. However, other bacteria like Klebsiella, Proteus, and Staphylococcus can also be responsible. Factors that increase the risk of infection include female anatomy, sexual activity, certain types of birth control, urinary tract abnormalities, blockages in the urinary tract like kidney stones, a suppressed immune system, and the use of catheters. Now let's understand how a UTI develops. Bacteria typically enter the urinary tract through the urethra. From there, they can travel up to the bladder, causing cystitis, which is a bladder infection. If the infection isn't treated, it can ascend further up the urinary tract to the kidneys, leading to pyelonephritis, a kidney infection. This can be a more serious condition. The body's natural defenses, such as the flow of urine and the immune system, usually work to prevent infection. However, when bacteria overwhelm these defenses, an infection takes hold. UTIs are incredibly common, especially in women. It's estimated that about half of all women will experience at least one UTI in their lifetime. While less common in men, UTIs can still occur, particularly in older men with prostate issues. Factors contributing to the prevalence include shorter urethras in women, making it easier for bacteria to reach the bladder, and the widespread presence of bacteria in the environment. The symptoms of a UTI can vary depending on the location and severity of the infection. Common symptoms include a frequent urge to urinate, a burning sensation during urination, passing frequent small amounts of urine, cloudy or strong smelling urine, pelvic pain, and sometimes blood in the urine. If the infection has reached the kidneys, symptoms may include fever, chills, flank pain, nausea, and vomiting. If you experience any of these symptoms, it's important to seek medical attention. Diagnosing a UTI usually involves a urine test called a urinalysis. This test checks for the presence of bacterial white blood cells and red blood cells in the urine. In some cases, a urine culture may be performed to identify the specific type of bacteria causing the infection, determine the best antibiotic to use. In cases of recurrent UTIs or suspected kidney involvement, additional tests like ultrasound or CT scans may be necessary to rule out any underlying abnormalities. UTIs can be classified based on the location of the infection. Cystitis refers to an infection of the bladder, while pyelonephritis refers to an infection of the kidneys. UTIs can also be classified as uncomplicated or complicated. Uncomplicated UTIs occur in otherwise healthy individuals with a normal urinary tract. Complicated UTIs occur in individuals with underlying medical conditions, urinary tract abnormalities, or antibiotic resistance. Treatment for UTIs typically involves antibiotics. The specific antibiotic and the duration of treatment will depend on the type of bacteria causing the infection and the severity of the symptoms. It's crucial to complete the entire course of antibiotics, even if you start feeling better, to ensure the infection is completely eradicated and to prevent antibiotic resistance. In addition to antibiotics, drinking plenty of water can help flush out bacteria from the urinary tract. Pain relievers may also be used to alleviate discomfort. Preventing UTIs involves several simple strategies. These include drinking plenty of water to help flush out bacteria, urinating frequently and promptly when you feel the urge, wiping from front to back after using the toilet, avoiding irritating feminine products, and emptying your bladder after intercourse. For women who experience recurrent UTIs, other preventive measures may include taking low-dose antibiotics, using vaginal estrogen cream, or drinking cranberry juice or taking cranberry supplements. The prognosis for UTIs is generally good with prompt and appropriate treatment. Most UTIs clear up within a few days of starting antibiotics. However, recurrent UTIs can be a challenge. Recent research focuses on developing new antibiotics to combat resistant bacteria, exploring alternative therapies like probiotics and herbal remedies, and understanding the role of the microbiome in urinary health. Researchers are also investigating the development of vaccines to prevent UTIs, particularly in women who experience frequent infections. The future holds promise for more effective and targeted approaches to UTI prevention and treatment. Thank you for joining us on this informative journey.